Senator Nathan Johnson.
Good morning. Thank you for holding these hearings and for allowing me to testify here. There's going to be a number of people testifying, and I know some already have, who have a great deal of detailed and technical knowledge on this subject. I won't attempt to compete from them. As a senator and as a member of the public, I wanted to testify from the political and the public perspective. To put it in context, the reason we're here essentially is that the transformation waiver that was granted in late January, of course, has been rescinded by the current administration. The reason cited is the lack of public input and public hearings. And while there were public hearings before the most recent transformation waiver was granted, they were prior to substantive changes. And so we're now back at the table. We have a new application for the same deal that was cut in January, but under different circumstances. And so some of the input today from the experts, as well as some of my own testimony and urging, has to do with the fact that we're in some different circumstances and that we believe that the application itself and the overall approach ought to be examined in a broader context and perhaps to some extent modified in conjunction with working with our partners in the federal government. First of all, the mission, as stated, of this agency is not simply to reimburse healthcare providers for uncompensated care. The mission is to make people healthy. And one of the ways that we make people healthy, indigent people healthy, is by providing uncompensated care, which will only continue if we assure that healthcare providers are in fact compensated to some extent for the care that they provide. That's essential. We absolutely need these uncompensated care dollars, and this agency is doing the right thing by pursuing those dollars. However, we do have a bit of an upstream-downstream problem. And by pursuing funding almost solely, that's not fair, largely through the uncompensated care mechanism, we're essentially attempting to fish the drowning people out of the stream downstream. If we can provide health insurance to some of these people, we're going upstream. We're putting up guardrails and we're teaching people how to swim, so we're not fishing them out, hopefully before they drowned. But we're preventing them from ever getting in that situation in the first place. And then when we get rid of the metaphor and go into reality, there's a lot of cost savings to that approach as well as, and this is a very important thing to all people in Texas, we like to take a dignified approach to life. And charity care does not give people the same dignity that having health insurance and access to care gives them. And so we think we really need to tilt this approach when we're thinking about what is the best way to draw down our federal dollars and use them to make our state and our people healthy, to stabilize our healthcare systems, to ensure that hospitals and doctors continue to practice, nurses, construction workers, and everybody in that whole economic sphere can continue to do the things that we've been doing, only better. Okay. First of all, let's assume for the moment that everything went right in January. I don't think it did. But I know that the executive branch of this state, this agency, and Governor Abbott worked very, very hard through many, many, many complex issues and got a heck of a good deal and brought uncompensated care, as many other programs, to this state. And that's commendable. But we're in different circumstances. And that approach, the approach that was taken then, was based on the information that we had then. What we did not know in January or December or November or October is that something called ARPA would exist and that it would award non-expansion states a 5% FMAP bump to their existing Medicaid population were they to expand Medicaid coverage, Affordable Care Act coverage to an indigent population up to 138% of the poverty level, a population which currently can't get insurance in Texas. We did not know that that would equate to $3.9 billion over 8 calendar quarters, over 8 fiscal quarters in Texas. And for the next biennium, $3.5 billion almost in Texas, were Texas to expand coverage under the ACA, whether directly through traditional Medicaid expansion or pursuant to a Section 1115 demonstration waiver. So when the calculus is made, how can we best utilize the dollars that we can draw down from the federal government? We didn't know that there was another $3.5 billion available just for this biennium to pay for this. It was a completely different calculus. And so for us to come forward at this moment with the exact same plan that we had in January, when we didn't have $3.5 billion across 7 calendar quarters or $3.9 billion across 8 fiscal quarters, sorry, I keep saying calendar, fiscal quarters, would be remiss, right? We're not using the right numbers this time. We've got to go back and use the right numbers. So when we're figuring out how to allocate our resources, we got to know what resources are available. So I think we need to rethink the whole thing on that basis alone. I don't know to what extent that's going to adjust the numbers, whether we're going to continue to put all of our money on the downstream effort for uncompensated care, or whether we look now, you know what, we need to shift some of the emphasis to our upstream because there's a bunch of money for us to do some upstream, take some upstream precautions, measures, teach people to swim. But in this case, we're teaching people to take care of themselves. We're making them ready for work. We're making them healthy. All the things that go along with the dignity and efficiency of having people insured rather than uninsured. There's new money on the table. Secondly, the legislature depends on this agency, co-equal branches of government, to advise policy. We have got to have complete information. Everybody knows that if we're talking about coverage expansion, in Texas it's difficult because it is politically supercharged. And the only way to overcome political inertia is through clean, clear, unbiased information. And so I, as a senator in a co-equal branch of government, call upon you and this agency and leadership in the executive branch to bring to us a fair, clear, honest calculation of what are the numbers we're dealing with. It's not just uncompensated care we're talking about. There were hearings in the Senate Finance Committee. There were questions about what expansion would cost, and the agency came forward with $1.1 billion. Which stands in stark contrast to studies done by the Legislative Budget Board, Randy Fritz and John Pitts, Laura Daig at Texas A&M, Ray Perryman, Texas 2036. We have a long list of studies done by objective parties, whether they're in academia or in the public sector or for members of the public sector or for higher economists in the private sector, and they're all reaching the same conclusion, and that is that Texas needs to be doing something different than what it is doing, and their numbers are slightly different. Actually, no, they're starkly different than what was presented to the Senate Finance Committee. And it doesn't mean that anything presented to the Senate Finance Committee was incorrect. It's simply not the whole picture. And as a legislator, as a member of the Senate, and somebody who works with the House, I know how hard it is for us to talk about this stuff without complete information. So again, in the context of crafting a new 1115 waiver, I think we need to go back and make sure that we're using all the numbers that are relevant so that when we're looking at Article 2 funding, we're talking about the cost that might be saved were we to expand Medicaid in terms of coverage for pregnant women, women with breast and cervical cancer, community health programs, substance abuse treatment, HIV venomication programs, kidney health care programs, and that's just Article 2. There are also savings available under Article 5. They're complex, they're difficult, but that's our job. We're professionals, and that brings me to the final point. You all are professionals. This agency is not just a collection of functionaries cranking out numbers they're told to crank out. You are the experts, and you know what you're doing. I've worked with you. You all are good at this stuff. And so I'm counting on you all to lead us by providing us information that will allow legislators to go back to their constituents and explain to them why what we're doing is the right thing, provided we are doing the right thing. And we can, if we have this information. Otherwise, I'm not sure we get there. So we have to keep in mind, to wrap things up, when we, in this 1115 waiver, we have to keep in mind that when we craft policies, whether it's at an agency level or a state legislative level, those policies have effects beyond the specific purposes for which they were crafted. They tell a political story. They usher in a political narrative. And whatever we do here with this 1115 waiver, we have got to make sure that it doesn't tell an inaccurate story, that we can take care of our uninsured population simply by the back door paying for charity care after the fact. That's a false narrative. And it's to the detriment of our health systems and it's the detriment of our people. This 1115 application should be crafted with in mind that we need both of these pieces. We need people covered to the extent we can, and it's not going to be that huge a percentage. Maybe 20% of our uninsured population gets picked up, but 20% is a lot of people. It's 1 million people, and it's all got to be budget neutral. And if we can lower the cost for that 20%, that first 1 million people that gets picked up under an ACA expansion, we've got more room to do incredible things through our district successor programs and uncompensated care programs and the innovation that's happening out there in the private sector at our private hospitals and in our public hospitals. We're in so much more powerful of a position. So when we craft this policy, we need to send the right message to our public and to our legislators that we are taking the wisest possible apolitical, non-ideological approach to caring for the indigent in Texas and strengthening our health systems overall for the uninsured as well as the insured. Thank you very much for listening to me.